everyone, today we're going to be talking about skin tightening and skin tightening treatments and what you need to know. If you understand this will help you better find a skin tightening or how to tighten your skin that's best for you. So in my shorts I talked about extrinsic and intrinsic aging, but the major role of skin aging is a process called senescence. Now, this is a process where the cells are alive, they're functioning, they're older, but they're not dividing and they're not dying off. So these large number of cells can trigger a harmful material which can cause inflammation. Now, they can also damage the nearby cells, and a good example of this would be cancer, autoimmune disease, and accelerated aging. Now, as far as the skin goes, senescent keratinocytes as well as melanocytes, the fibroblasts, it can affect the fibroblasts, basically can cause accelerated aging and pigmentation issues. Hi, my name is Christy, and for those of you who are new to my channel, I have been professionally treating clients for over 17 years. This is actually my fourth career. I've done over 26,000 different treatments without the use of topical medication. And for those of you who, somebody always puts in the comment that if you want to see examples of my before and after photos of some of my clients who graciously volunteered their pictures, you can see that in the link in the description below. This was all done without the use of topical medication. Now let's take a look at this infographic right here that my editor graciously created for me to help me explain the different modalities of skin tightening. So the first one we're going to go over is radiofrequency. So radiofrequency actually uses thermal energy or heat to create controlled damage to the dermal layer, and as a part of the healing process, the fibroblasts create new collagen and elastin. Now, because it uses heat, I don't recommend this for hyperpigmentation, the treatment of hyperpigmentation, because heat can actually stimulate pigmentation formation. Now, this can be used obviously both at home as well as with a professional. And this is typically used for slimming of the face or the jawline or facial contouring. Now, as far as the results go, they're rather short-lived, and they recommend continuous treatments of this to have longer lasting results. Now, if you do this professionally, they typically will do more of a direct thermal effect or activity of this, and this you have to be careful even actually with some of the home treatments, because this can cause low level temperature burns, and what that can do is cause damage to the structure of the collagen in your skin. Okay, the next one we're going to be talking about, which is actually the most superficial of all the treatments, is the LED light treatment that's used for skin tightening. Now, this can vary a lot depending on the light that you use, how much time that you use it, and the frequency, as well as your Fitzpatrick skin type. But I do want to mention there's two studies that were done using these LED masks. So the first one was a non-randomized controlled group using a LED mask called the Para Derma LED mask. They used this 2 times a week for 8 weeks. And basically, they found a overall improvement in skin texture, skin hydration, as well as elasticity, better than the control group. Now, this next one was not an LED mask. It was actually a handheld. And if I can find the products that they used in the study, I will put it in the links below. I cannot guarantee it. Okay, so I apologize if I forget, but if I don't put it in, it's because I did not find it. So this handheld light, they used a combination of LED light as well as red light therapy. Now, they used this 8 times over a month or 4 weeks. Now, 59% of the people that were used in this trial found improvements in their tone, texture, and for their fine lines. But they did not see any improvement in hydration or elasticity. Now, here's something interesting. They actually found the most improvement around the eyes as well as the nasolabial folds. Now, as far as long-lasting results, what they found was the longest follow-up time after these studies were done was only 12 weeks after. So they can't verify if they're actually long-lasting results. The other interesting thing is when they did a survey, a follow-up survey of the satisfaction of these devices between a scale on a scale of 1 to 5, it was just a 3. So if any of you guys have used these LED masks or radio frequency, go ahead and put in the comments what you found. It could be both good or bad, it doesn't matter. It lets us know and gives us more insight on the type of treatments that we may be considering. So we would really appreciate it if you can share with us what you found and what type of product that you also use. If you're liking this information so far, give it a thumbs up, letting me know that this is the kind of information that you are looking for. Okay, so moving on, here's some of the pros and cons of these skin tightening treatments. So because these are superficial skin tightening treatments, you know, they don't go far down, and I'm talking about the most of the home treatments, because they only affect, for the most part, the dermal layer. Some of them go down further into the subcutaneous layer, and then there's another one that goes down even deeper. But the superficial ones, they're not long lasting. The pros of this is it can oxygenate the skin, increase or stimulate blood flow to the skin, showing improvements in skin tone. Because it is superficial, there's less risk, obviously, and with this though, there is no increased penetration of any, you know, skin products that you are using for this, but how your skin responds to those skin products after you use them, you can or you may be able to see some improvements. Now let's look at microcurrent. So I'm going to refer back to this the chart that I referred to earlier, showing the different levels of how radio frequency and LED light, as well as microcurrent, where it affects the different layers of the skin. So where radio frequency uses thermal energy or heat, basically creating controlled damage to the skin's response to repair itself will then make new collagen and elastin. Microcurrent uses very small currents of electricity throughout. All of the cells have somewhat of energy levels in them. And so basically microcurrent uses the electrical energy to create a chemical reaction in the skin, and this stimulates new tissues synthesis, new nerve formation, as well as increasing blood circulation. But the most important thing that I think in regards to skin is it actually increases the energy resource or the life source in every cell, which is the mitochondria. The mitochondria produces an energy resource called ATP, and it's in every single cell, and that stands for adenosine triphosphate. So where most of the skin tightening treatments will use a method to cause some inflammation to the skin, whether, you know, it's by heat or sound energy, it causes controlled damage to the skin, right? And then the skin responds by creating new collagen and elastin. Microcurrent actually increases the energy resources of every cell. So the younger you are, the more energy resources you have in your cell. That's why you guys can recover faster, your skin heals faster. But as you get older, the energy resources get lower and lower and lower. And so that's why the older we get, the less energy that we have overall. Our skin doesn't rebound as quickly and doesn't heal. So by increasing the energy resources of every cell, your skin starts to over time respond as if it is younger because it has more energy. So microcurrent, as far as the face goes, I do want to say it can change the appearance of the face because it strengthens the muscle, and it has been shown to increase the muscle size. Microcurrent therapy has been used more on the body for that. So as far as fat loss, there is no direct evidence of that, but because it strengthens and increases the muscles in the face for that, it can change the way that your face appears. Now, as a microcurrent as a treatment for skin sagging, facial drooping, in the 1980s, actually physicians were using microcurrent treatment as a part of to treat facial drooping for patients with Bell's palsy. And that's actually when it was first FDA approved for that. So I've been using microcurrent for skin tightening since 2017. And I've been using it as one of the many modalities for my clients. So if you would like to see a live demonstration of how I use microcurrent treatment, please make sure that you subscribe and hit that notification bell, because remember, makeup is an art, skincare is a science. See you in that live video.